Hi guys, and welcome to today's video. I hope you're all doing well. Today guys, we are going to be looking at another case in China. I was actually researching for different types of cases, to be honest, and this one just kind of came up. It's always the cases I'm not researching, the most random cases that suddenly appear when I'm looking for something else that come up and I think, oh my god, I need to cover this one. So for today's case guys, we are going to be talking about a woman who died during giving birth, during labour, and the reasons behind it. So again, I just want to put out a disclaimer again that if you're very sensitive to childbirth death, I want to say, please be aware of that before watching this video today. So this is a case of a lady called Ma Rongrong. She was 26 years old and from the Shanxi province of China. She was married to a gentleman called Yan Zhangzhang or Yang Zhuangzhuang. Sorry guys, and he was 29. It's known that they weren't, I wouldn't even say like generally okay financially. They were more in a lesser level financially, not directly poverty, but probably a little bit just above, okay? And but they had a happy life and everything. So essentially, Ma Rongrong, she was pregnant and she reached the 42nd week of pregnancy. Now generally women, they tend to give birth between, I'd say, 38 to 39 weeks of pregnancy. Ma Rongrong was 42 weeks pregnant, so she was quite a bit overdue. And generally when women reach that point, or before they even reach that point, I'd say 42 weeks, which is quite rare, they will tend to be induced or be booked in for a C-section, etc. So essentially guys, on the 30th of August, Ma and Yan, they met up with the doctor who was due to deliver the baby. Okay, this was the 30th of August 2017. Now in China, until probably like 2015, it was very common for women to actually have C-sections because of the one-child policy that used to exist in China. From 2015, that one-child policy was abolished and people are now allowed to have 2 children, right? So from the point that the one-child policy was abolished in 2015, they decided to reduce the amount of C-sections done just because they felt like, well, essentially China was the country in the world with the most amount of C-sections done, like more than 50% of deliveries were C-sections. So after they abolished the one-child policy in 2015, they decided that now they want people to have more natural births. They're going to reduce the rate of C-sections. So essentially C-sections, it was considered they should only be done if it was a very high risk pregnancy. It couldn't be done upon request of the patient, etc. So essentially a C-section can only be performed if it's a very high risk situation. If it's very high risk, in China, the next of kin, the family, they have to agree that the patient can have, so that their family member can have the C-section. The patient can't just sign a consent disclosure that they are okay to go ahead with it in case something goes wrong. The family actually have to sign off on a consent disclosure for the patient to be able to have a C-section, so that if something goes wrong, the hospital isn't held liable. I think the husband can also sign off on it, but the actual patient can't sign off on her own consent and disclosure to have a C-section, which is absolutely ridiculous, right? So basically the doctor was like, yeah, I think you should still have a natural labour, blah 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 blah, at 42 weeks, right? So this was the 30th of August 2017 when Ma and Yan have gone to the hospital. The next day, 31st of August 2017, so Ma is in labour, goes to back to the hospital with her husband, and her family's there as well, right? So time is passing, it's around like 5 p.m. or something on the 31st of August, and Ma is in a lot of pain. Like the labour pain is very excruciating for her. Now when it comes to labour pain guys, obviously it's different for every woman. I want to say there were women who feel they experienced it at a very mild level, and there were women that experienced it at a much more severe level where it's debilitating for them, okay? And I think it's important to remember that the pain is different for everyone. And firstly, unless you've experienced going through a labour, it can be very difficult to understand how it is, especially if it's gone on for hours and hours or several days or whatever. It can be really difficult to comprehend something like that, okay? So essentially, Ma was in an extreme amount of pain, okay? She's in the delivery room, and in China, for some reason, none of the family members are allowed to be in the delivery room, not even one family member. And bearing in mind, guys, this was way before COVID. This was 2017, so it's nothing to do with COVID restrictions or anything. It's just that they don't allow any family members, including the husband, in the room when the woman is going to give birth. So Ma was in a lot of pain, and she was actually in a ward with about 5 other women all in the same room in labour, which I found really odd, to be honest with you, because I mean, as far as I'm aware, in other countries, if a woman's in labour generally, she would be in one room on her own. She wouldn't be in a room with 5 other women who are all in pain in the middle of labour about to give birth. So I found that very strange, first of all. But yeah, she's in a lot of pain. So she actually comes into the hospital corridor. She gets out of the room and says, look, I'm in a lot of pain. I'm in a lot of pain. Like, I want the C-section, right? So essentially, the doctor who was in charge, he kept saying that, no, you know, like the circumference of the head is too big to do a C-section now, and the labour's too far. We're just going to have to deliver the baby. Like, we can't do a C-section. And the husband was like, my wife's in a lot of pain, like, blah, blah. The family, apparently, as in Ma's family, they were like, no, like, can you give us the forms? Like, we'll sign them. Like, we don't mind. And when this case sort of gets further down the line, essentially the hospital said that the family objected to signing a consent disclosure form for Ma to have a C-section because they were apparently quite poor, so couldn't afford it. And her husband has come out, and the family have come out and said, no, we would have never objected, although we're not comfortable, well off, we would have paid for it because she was in a lot of pain. We had no issue, actually, and we actually requested it, but the hospital would not give us the forms to complete so that we could sign the consent disclosure so that she could have the C-section. Because this is a hospital, there's a lot of CCTV everywhere, so there are images and videos of exactly what went on, which, to be honest, in my opinion, makes the hospital look like they not only didn't do their job, they committed acts of clinical negligence, quite frankly. So Ma's gone into the corridor now. It's quite a big, wide corridor, obviously, because it's a hospital. And she's gone to look for her family and her husband because she's like, you know, she wants them to, obviously, she needs something to be done. While she's looking for them, she finds them. And then apparently she's kneeling on the floor because she's in so much pain, just saying, like, I need the C-section. Like, please, I need it. So her family at this point, they're talking to the doctors and nurses saying, like, right, can you sort this out? Like, give us the forms, basically. And they're just not giving them any documents to sign. And she's, like, now on the corridor floor of the hospital in pain, you know, and, like, she just can't bear it. So anyway, she gets up when she realises, look, they're not going to do anything to help me. And her husband, he gets on the phone and he's trying to find like an actual private doctor to come and help deliver the baby, because he realizes, look, this doctor that's there right now, he's got no clue. He's got all the gear but no idea. Do you know what I mean? And his wife's in an extreme amount of pain, so he starts calling on from his mobile, trying to get another private doctor there to do the delivery, right? And he's in the corridor doing that. And then the family, I think they're trying to convince the nurses and doctors to give them the consent forms so that she can have the C-section. So all this is going on, and now Ma's gone back in the delivery room. So Ma's gone back into the delivery room now where the other 5 patients are. Her husband's on the phone trying to get a private doctor to do the delivery. Patients are still begging the staff to give them the consent disclosure form so they can sign off for the C-section. This is all going on in the corridor. Ma's walked back into the delivery room with the 5 other patients. From everyone's perspective, they all think Ma is in the delivery room with these other 5 patients. Actually, Ma has found another door which is adjacent to that room. So, you know, guys, in a lot of, I've noticed this actually, especially in like labour and delivery wards, right? There's often like doors adjacent with other rooms that you can just take the patient into. So this was the case in this situation where there was another door on the side next to this room basically. So Ma has now gone into that room, okay, and that's actually another delivery room, but no one's noticed that. And I think the other patients in the ward there didn't notice because they're also in labour, obviously. So, do you know what I mean? It's not something they're going to think, oh, why has she gone in the room next door, whatever. And then everyone else is in the corridor, so no one's seeing this. So she's now gone into this other delivery room next door, and she's got up on the windowsill ledge, and she decided to make the decision to jump out the window. And then suddenly, I think one of the nurses goes back into the delivery room to, you know, check on Ma, look for her. And that's when they realise she's not there. So I think that they think that she's gone off somewhere else, that she's gone off down the corridor into another room, or like they just think she's gone somewhere else. They don't at this point realise she's committed suicide and jumped out the window. The other patients in the room don't realise because obviously she went next door, guys, and they just saw her walk off. They didn't see her jump from the window because that door's then closed and they didn't see nothing. So no one actually knows where she is at this point. No one knows she's jumped out the window, nothing. So everyone starts looking for her in the hospital. Suddenly her husband looks out from one of the windows and he sees his wife on the ground outside, and she's got no clothes on and she's just lying there lifeless. And it's unbelievable, guys, that a woman who was healthy, a 26-year-old woman who was healthy, went to a full-term pregnancy where the baby was due. It's unbelievable that it would get to this point where they don't realise she's in such excruciating pain that they need to act much faster in a more, I can't even say logical, like they just need to use their common sense and medical processes to support the patient. It's really shocking that it could get to a point like this, to be honest with you. So basically, it was investigated, but it didn't even end up going down a really, how can I say this, a really expansive legal routing. Basically, the hospital, they ended up paying out the family, which, to be honest, this is a woman who's lost her life needlessly, a baby that was supposed to be full term that's died needlessly, and they just paid out the family. The family basically started to do a lot of like TV interviews, etc. about this because obviously they were really devastated. They wanted to raise awareness of the situation, and the hospital basically came back and said, look, we'll pay you XYZ amount if you stop doing media interviews. And that's basically what happened. They took the money and stopped doing media interviews. However, the legal system in China, they did say that things need to be put in place immediately in that hospital to prevent these kind of situations, and they said with immediate effect. They also 2 of the staff that were on duty that day, that were there when all of this was going on in the corridor, they were actually dismissed. They lost their jobs from the hospital as well. So that did happen, but it's like there was no real proper investigation done. And even the fact that the family were paid out, I mean, this is such a serious thing. I feel like in other countries there still would have been a much more lengthy investigation legally. There would have had to be legally, irregardless of whether the hospital wants to do a payout. This is a woman who's jumped out of a window in a hospital while she's heavily like due to give birth. This is not a situation of just negligence where someone's there, you couldn't revive them. Okay, what's happened? This is something that shouldn't have ever happened. So it is shocking that this wasn't like an 18-month court case investigation situation. I always feel like, guys, when people are experiencing physical pain, It might be that prior to experiencing any physical pain that they are acting normally, they're fine, and that physical pain can push them to a point that is so unbearable that mentally they just cannot cope with that pain anymore. And often in lots of different cases, not just child labour, but giving birth during labour, not child labour, sorry guys, there are other types of pains where when people aren't in that pain, or if they've never been through it, it's really difficult for them to understand. Even there's medical professionals who don't comprehend fully what that pain is, and this is what happens, cases like this, because the person cannot just bear the pain anymore. Or it could be not just because you've experienced it, that another person is experiencing the pain at the same level. What you think is tolerable might not be tolerable for them, because remember, we all have different pain thresholds. So it's just so sad that it got to a point where, firstly, they could have given her a C-section. Secondly, they should have stepped in. Now, in the times we live in, for labour, there's not just epidural, there's other types of pain relief, there's different things that can be done. And a country like China has the resources to do it. So it's quite shocking that this wasn't handled properly whatsoever. Anyway, guys, I will leave this case here. Just so that you guys know, I am currently researching some cases about gynecological conditions in women where they've got to a point where the conditions are so painful, like that they struggle to continue with living. Because I feel like it's really important to raise awareness of this. So I'm looking into conditions at the minute like PMDD, endometriosis, adenomyosis, etc., and other conditions, or conditions like that were misdiagnosed. So look out for some more cases I'll be doing surrounding that on my channel. Of course, guys, feel free to comment under this video if you have any case suggestions, of course, your thoughts on this case, and I will see you again very, very soon, of course, for another video.